Welcome to Principles and Provisions of Person-Centered Care for Assisted Living Residents, a training for non-direct care staff, presented by My ALF Training. By the end of this training module, participants will understand the key principles of person-centered care and the specific practices that they can implement in their daily interactions with residents, including those with Alzheimer's disease or dementia. Person-centered care is an approach that puts the individual at the center of care, ensuring that residents' values, preferences, and needs are respected and addressed in every aspect of their care. This is especially crucial when working with residents with Alzheimer's disease or dementia, where cognitive and memory challenges can make it harder for individuals to express themselves or to participate in decisions. This module provides specific practices, concrete actions, and guidelines that staff can adopt to ensure that person-centered care is delivered consistently and effectively. Respect for individuality. All staff should actively seek out and incorporate the individual preferences, routines, and cultural backgrounds of each resident into their care practices. Actions for implementation. All staff take the time to learn about each resident's history, preferences, and hobbies. This information can be gathered during resident intake or through conversations with family members and other caregivers. For residents with Alzheimer's and dementia, regularly review life histories and preferences with family members to create an individualized care plan that accounts for cognitive changes. If the resident is unable to recall personal details, use other sensory cues like music, familiar smells, or photos to stimulate memory. Choice and autonomy. Empower residents to make choices about their daily activities and care, even if their cognitive abilities are limited. Actions for implementation. Offer choices that are simple and meaningful, such as selecting meals, activities, or preferred seating arrangements. Ensure that options are limited to avoid overwhelming the resident. For residents with Alzheimer's and dementia, provide clear and simple options. For example, offer 2 choices for breakfast rather than a full menu. Use visual aids, pictures of food or activities to support decision making. Holistic care. Address the whole person, physical, emotional, social, and spiritual well-being through personalized interventions and a nurturing environment. Actions for implementation. Organize activities that cater to residents' emotional and social needs, such as group exercises, arts and crafts, or spiritual services. Provide quiet time and space for relaxation. For residents with Alzheimer's disease, focus on nonverbal interaction that connect emotionally, like using music therapy, gentle touch, or reminiscence therapy. These can be more effective for those who struggle with verbal communication. Collaboration and communication. Foster open communication among residents, families, and staff to ensure that care is consistent and aligned with the residents' needs and preferences. Actions for implementation. Hold regular meetings with team members to discuss each resident's care plan and any changes to their condition. Use written notes, care logs, and technology to communicate effectively. For residents with Alzheimer's and dementia, communicate with clarity, patience, and respect. Allow the resident extra time to process and respond. Collaborate with families to address communication barriers and provide insights on preferred methods of interaction. Dignity and respect. Ensure that each resident is treated with dignity, irrespective of their cognitive or physical limitations. Actions for implementation. Address the residents by their preferred names, listen actively to their concerns, and maintain a respectful tone in all interactions. Ensure when providing care and respect personal boundaries. For residents with Alzheimer's and dementia, use positive reinforcement to support a resident's self-esteem. In cases of confusion or agitation, use gentle redirection and avoid confrontational language. Make accommodations for any physical challenges like providing mobility aids or extra support during meals. Practical practices for non-direct care staff. Each staff role contributes to the overall experience of person-centered care. Below are the specific practices that various staff members can incorporate into their work. Maintenance staff. Create a familiar, safe environment for residents, particularly those with Alzheimer's or dementia. Actions. Ensure that rooms are personalized with familiar objects or photos that might help trigger memories. For residents with cognitive impairments, ensure safety features like grab bars, non-slip rugs, and adequate lighting are in place. Administrative staff. Support a smooth, well-organized schedule that aligns with residents' preferences and needs. Be flexible when scheduling appointments and activities to ensure that transportation to and from appointments is on time, and be respectful of residents' routine. For residents with Alzheimer's or dementia, ensure that appointments are simplified and confirmed to minimize confusion. Direct care staff. Promote an enjoyable and dignified dining experience that takes into account residents' dietary preferences and cognitive needs. Offer familiar foods and preferred seating arrangements. For residents with Alzheimer's or dementia, use picture menus or food samples to make meal choices easier. Provide assistance as needed to ensure residents can feed themselves independently or offer help in a respectful, dignified manner. Housekeeping staff. Practice. Ensure that residents' living spaces are both clean, comfortable, reflecting of their individuality. Pay attention to personal preferences in room organization and cleanliness. For residents with Alzheimer's and dementia, maintain consistency in room layout and ensure that items are placed in familiar spots to reduce confusion. Practices of person-centered care are essential in creating an environment where residents, including those with Alzheimer's or dementia, feel respected, empowered, and cared for. By applying the principles of person-centered care in concrete actions, respecting individuality, offering choices, providing holistic care, collaborating effectively, and upholding dignity, staff can create a supportive and personalized experience for every resident. Take a moment to consider how you can implement these practices in your role, whether it's through offering choices, maintaining communication, or adjusting your environment. Each practice plays a part in enriching the lives of the residents that you serve.